all to sailtomdsacademy Dental Academy. So my dear GPSC aspirants, many of you have the doubts that what is the course and what is the syllabus of the GPSC. Today we'll deal with that. Okay, you can watch my previous video. In that I have explained everything regarding the GPSC, starting from the date, how we have to do form filling, eligibility, and everything has been explained. Okay friends, so we'll start with it. So what is the syllabus they are asking? Okay, any MCQ exam you take, NEET, AIMS, PGI, they all have same syllabus that is prescribed by your DCI. So GPSC also has the same syllabus. But when you open GPSC website, when you click on that GPSC course, the 11 pages PDF is to open. और तुम लोग देख के डर जाते हो. So no need to get worried. I have explained in simplified manner that what you have to study according to the subject. Okay friends, and any help you need, I am conducting this 3-month the GPSC revision series. For detail regarding that, you can mail me or you can WhatsApp me on the number given in the description box. So we'll talk about the syllabus for your GPSC. First we'll take the anatomy. You should have the detailed idea regarding the anatomy and the osteology of head and neck. Little bit overview of the thorax, abdomen, extremities and the brain. Embryology of the head and neck should be thorough, like your development of palate, face lilia, pharyngeal arches, pouches lilia, tongue lilia, all that you should know. Then in physiology you have to study all the system. The most important system in the consistently asked question is from the blood, endocrinology, CNS and the CVS. From these 4 systems, many times 90% of physiology question has been asked. But you have to see other system also, like your digestive system, excretory system, reproductive and special senses. In biochem, thorough with your metabolism, like your fat, carbohydrate and protein metabolism. Know the structure of DNA and the RNA properly. Your biochemistry is done. Okay. Oral histology and oral anatomy. You have to study in histology your enamel, dentin, pulp, cementum, PDL, alveolar bone and oral mucous membrane. And anatomy, you have to know the basic important landmarks of your primary and the permanent teeth. In pathology, inflammation and healing should be thorough. Okay, and also you should have little knowledge about the cell death and the cell aging process. Then microbiology, thorough with your bacteriology, virology, immunology, parasitology, mycology. Okay, have a little bit idea about sterilization and disinfection of your dental instruments and also know about the different culture techniques for gram positive and gram negative bacteria. Pharmacology, you people are lucky that you have been spared. You have to study the pharmac part of your dentistry only, that is your antibiotics, analgesics. You should know about your bleaching agents, your fluoride therapies, your dentifrices, your styptics, your astringents, your oppidants, etc. Okay, know about every type of mouthwashes, what are the fluoride content is there, what is the ppm in there, know your what are the dentifrices you are prescribing, what ppm they contain. Many times they are asking what is the dosage for the analgesic and the antibiotic in children and the adult should be known. Then in materials, everything you have to study, know about the impression materials commonly used, important question they are asking, have a thorough knowledge about the dental cements, composites, polishing, how to do in the dental material part, and also many of the questions they are asking that how your crown is getting fabricated, that is your dental casting investments. Okay, dental materials is most important part, वो तुम्हारे prosthodontics और conservative dentistry से related है. So do it properly and in. Then your oral pathology in the oral medicine, you should know developmental disturbances, cyst, tumor, pulp-peripheral condition, infections of the oral cavity, all infections you should know, bacterial infection, viral and the fungal infection. Then little bit about the salivary gland disease and the diseases of the nerves and the pigmentation disorders. Okay, then mostly don't try to don't forget to read the last 15 to 70 pages of your navel. Okay, it's very important. Then medicine, remember most of time they ask question from the hematology and from the CNS. So please be thorough with the disease part of the system. As infection we are doing in oral pathology, so it's good you have been spared. Now have a little bit information regarding the GIT, respiratory systems, the renal system and the endocrinology also. General surgery have a thorough idea for the shock and the hemorrhage. Okay. Also know the disease of your larynx, nasopharynx, nervous systems and the fractures. All the maxilla and mandibular fractures you should know. Then in considered dentistry, know about your materials, know about the caries in detail, know about the amalgam, composite, your gold, your inlay and your porcelain restoration. Then about the oral surgery, LA and the exodontia should be thorough. Your dosage of the LA, techniques of the exodontia, different kinds of space infection, TMJ disorders, how will you treat cysts and tumors, and few parts of the pre-prosthetic surgery. Okay dear friends, you should know all this thing. Then orthodontics, thorough, about the theories of growth and development, know about the landmarks of cephalometrics, have knowledge about the fixed, removable and the myofunctional appliances, know the theorems of your retention and how to avoid the relapse. These are the few important things you should know about the orthodontics. Then in pediatric dentistry, have a thorough idea about the child psychology with theory which author is given, know all the pharmacologic and non-pharmacological behavior management. Nowadays a conscious sedation is in the demand, so please have a thorough idea about the conscious sedation. You should know about the special child, that is your handicapped children's, and also pediatric endodontics, that is a pulpectomy, pulpotomy, apexification, apexogenesis, and detail about the trauma. You should know how to manage the primary teeth and permanent teeth trauma and classification. हम लोग सिर्फ कॉलेज में एलिस एंड डेविड क्लासिफिकेशन पढ़ते हैं, बट मेनी टाइम नाउ दे आर आस्किंग द WHO classification also. In public health dentistry, learn about the epidemiology, how to prevent your dental caries, how to prevent your oral cancer. You should know how to prevent the periodontal condition. Indices, they are not asking that much. I have not seen any question in past 5 years from indices, but know a little bit about your OHI, DMFT and the periodontal index. Have a detailed idea about the biostatistics. They are asking all that chi-square test, t-test, so you should know. Then in periodontology, know about the diagnosis, treatment planning, instruments in periodontics, periodontal disease, your periodontitis, different types of periodontitis, oral hygiene methods, your brushing techniques, you should thorough. Your flap surgeries also you should know, the different types of flaps and everything. Then endodontics, biomechanics, that is from your access opening, biomechanical preparation to your obturation, different kinds of bleaching, your surgical endodontics, that is your apexectomy, lasers in endodontics, they are asking nowadays many questions, and also the instruments and materials like your sealers, your files, reamers, etc., whatever you are using in your endodontics. Then comes your prosthodontics part, your RPD, FPD, CD and implant should be very thorough. Nowadays implant, they are asking many questions. You should know the paths of implant, different surgery of implants, what are precautions you should take before doing the implant and after the implants. So the prosthodontic has to be known in detail. Okay. Then my dear friends, 100 marks, they are asking the general knowledge paper. Mind it, this 100 questions will be in the Gujarati language, not in the Hindi or the English language. In that you should know about the geography of India, have a good idea about your geography related to Gujarat, culture heritage of India, history of India with special preference to the Gujarat, your Indian economy, Indian constitution, have as main ideas that what are the fundamental rights of the citizen and all that. Your general science, your environmental and the information technology should be known, and current affairs of the past 1 year. Okay friends, so this is all about your syllabus for your GPSC exam. Any doubts, anytime, you people are welcome to ask me. So thank you all and all the best for your exams, and keep on working.